51. Which of the following is a classic symptom of hyperglycemia? A. Shakiness. B. Blurred vision. C. Sweating. D. Trembling. Answer: B. Blurred vision. Rationale: blurred vision is a classic symptom of hyperglycemia caused by changes in the lens of the eye due to high blood glucose levels. Shakiness, sweating, and trembling are more indicative of hypoglycemia. 52. Which of the following is a common cause of diabetic ketoacidosis, DKA? A. Skipping insulin doses. B. Poor diet. C. Overexercising. D. Taking too much metformin. Answer: A. Skipping insulin doses. Rationale: DKA is often triggered by inadequate insulin levels, which can result from skipping insulin doses. The other options are not directly related to DKA. 53. Which of the following is a potential complication of untreated hyperglycemia? A. Diabetic nephropathy. B. Acute coronary syndrome. C. Hypotension. D. Anemia. Answer: A. Diabetic nephropathy. Rationale: untreated hyperglycemia can lead to diabetic nephropathy, a complication of the kidneys. Acute coronary syndrome and anemia are unrelated to hyperglycemia. 54. Which laboratory test is most commonly used to monitor long-term glucose control in diabetic patients? A. Serum glucose. B. Hemoglobin A1C, HbA1c. C. Serum cholesterol. D. Liver function test, LFT. Answer: B. Hemoglobin A1C, HbA1c. Rationale: the hemoglobin A1c test measures the average blood glucose level over the past 2 to 3 months, making it the most reliable test for monitoring long-term glucose control. 55. Which of the following is an example of a non-pharmacological intervention for managing diabetes? A. Insulin therapy. B. Regular physical activity. C. Oral medications. D. Continuous glucose monitoring. Answer: B. Regular physical activity. Rationale: regular physical activity is a non-pharmacological intervention that helps improve insulin sensitivity and control blood glucose. Insulin therapy and oral medications are pharmacological treatments. 56. What is a major risk factor for the development of gestational diabetes? A. Obesity. B. Hypertension. C. Older age. D. All of the above. Answer: D. All of the above. Rationale: obesity, hypertension, and older age are all major risk factors for gestational diabetes, a form of diabetes that occurs during pregnancy. 57. What is the main goal of diabetic diet management? A. To increase carbohydrate intake. B. To maintain stable blood glucose levels. C. To reduce protein intake. D. To avoid all fats. Answer: B. To maintain stable blood glucose levels. Rationale: the main goal of a diabetic diet is to maintain stable blood glucose levels by balancing carbohydrate intake and insulin sensitivity. Excess protein and fats should be limited, but not completely avoided. 58. Which of the following is the most appropriate exercise for a diabetic patient? A. High-intensity interval training, HIIT. B. Low-impact aerobic exercise. C. Strength training only. D. No exercise is recommended. Answer: B. Low-impact aerobic exercise. Rationale: low-impact aerobic exercises, such as walking or swimming, are ideal for diabetic patients, as they help control blood glucose levels without putting undue stress on the joints. 59. A diabetic patient is at risk for which of the following infections? A. Urinary tract infections. B. Respiratory infections. C. Skin infections. D. All of the above. Answer: D. All of the above. Rationale: diabetes increases the risk of infections due to weakened immune responses and high blood glucose levels, making individuals more susceptible to urinary, respiratory, and skin infections. 60. What should a diabetic patient do if they experience symptoms of hypoglycemia? A. Drink a sugary beverage. B. Take a hot shower. C. Exercise vigorously. D. Ignore the symptoms. Answer: A. Drink a sugary beverage. Rationale: if a diabetic patient experiences symptoms of hypoglycemia, such as shaking or confusion, they should quickly consume a sugary beverage or food to raise their blood glucose level. 61. What is the most common cause of hypoglycemia in diabetic patients? A. Excessive exercise without adequate food intake. B. Insulin resistance. C. Increased carbohydrate intake. D. Stress. Answer: A. Excessive exercise without adequate food intake. Rationale: hypoglycemia can occur if a diabetic patient engages in excessive exercise without sufficient food to balance insulin levels. 62. What is the most common form of diabetes in children? A. Type 1 diabetes. B. Type 2 diabetes. C. Gestational diabetes. D. Maturity-onset diabetes of the young (MODY). Answer: A. Type 1 diabetes. Rationale: type 1 diabetes is the most common form of diabetes in children, typically resulting from autoimmune destruction of pancreatic beta cells. 63. Which of the following is a common cause of diabetic retinopathy? A. High blood pressure. B. Poorly controlled blood glucose levels. C. Excessive alcohol consumption. D. Low cholesterol levels. Answer: B. Poorly controlled blood glucose levels. Rationale: poorly controlled blood glucose levels lead to microvascular damage, which can result in diabetic retinopathy. High blood pressure may exacerbate retinopathy, but is not its primary cause. 64. What is the recommended target for HbA1c in most adults with diabetes? A. 4 to 5%. B. 6 to 7%. C. 8 to 9%. D. 10 to 11%. Answer: B. 6 to 7%. Rationale: the recommended target for HbA1c in most adults with diabetes is 6 to 7%, which helps reduce the risk of complications while being realistic for most patients. 65. Which of the following is a symptom of diabetic neuropathy? A. Nausea and vomiting. B. Loss of sensation in the feet. C. Frequent urination. D. Increased thirst. Answer: B. Loss of sensation in the feet. Rationale: diabetic neuropathy commonly causes loss of sensation in the feet and hands due to nerve damage from prolonged high blood glucose. Nausea, frequent urination, and increased thirst are signs of poorly controlled diabetes, not neuropathy. 66. Which of the following medications is used to reduce blood sugar by increasing insulin sensitivity? A. Metformin. B. Glympyride. C. Pioglitazone. D. Liraglutide. Answer: C. Pioglitazone. Rationale: pioglitazone is a thiazolidinedione that works by increasing insulin sensitivity in muscle and fat tissue. Metformin also increases insulin sensitivity, but it works through a different mechanism. 67. Which of the following is not a symptom of diabetic ketoacidosis, DKA? A. Fruity smelling breath. B. Rapid, shallow breathing. C. Hypothermia. D. Nausea and vomiting. Answer: C. Hypothermia. Rationale: hypothermia is not a typical symptom of DKA. Fruity smelling breath, rapid breathing, and nausea/vomiting are all signs of DKA. 68. What is the effect of diabetes on kidney function over time? A. It improves kidney function. B. It leads to diabetic nephropathy. C. It reduces the need for dialysis. D. It prevents kidney stones. Answer: B. It leads to diabetic nephropathy. Rationale: over time, uncontrolled diabetes can damage the kidneys, leading to diabetic nephropathy, a common cause of kidney failure. 69. Which of the following is the primary mechanism by which metformin lowers blood glucose levels? A. Increases insulin release. B. Inhibits glucose production in the liver. C. Enhances glucose absorption in the intestines. D. Decreases renal glucose excretion. Answer: B. Inhibits glucose production in the liver. Rationale: metformin primarily works by inhibiting glucose production in the liver, reducing blood glucose levels. It does not directly affect insulin release or glucose absorption. 70. Which of the following statements about insulin therapy is correct? A. Insulin should always be injected after meals. B. Insulin is used only for type 2 diabetes. C. Insulin can help manage both type 1 and type 2 diabetes. D. Insulin should not be used in combination with oral medications. Answer: C. Insulin can help manage both type 1 and type 2 diabetes. Rationale: insulin is used to manage both type 1 and type 2 diabetes, depending on the patient's needs. It is not limited to type 2 diabetes. 71. What is the main goal of diabetes education? A. To promote weight loss. B. To teach patients how to administer insulin. C. To help patients manage blood glucose levels and prevent complications. D. To cure diabetes. Answer: C. To help patients manage blood glucose levels and prevent complications. Rationale: the main goal of diabetes education is to empower patients with the knowledge and skills needed to manage their blood glucose levels and reduce the risk of complications. 72. What is a common complication of untreated gestational diabetes? A. Increased risk of preterm labor. B. Type 2 diabetes in the child. C. Hyperthyroidism. D. Jaundice in the mother. Answer: A. Increased risk of preterm labor. Rationale: untreated gestational diabetes can increase the risk of preterm labor and other complications, such as high birth weight and neonatal hypoglycemia. 73. Which of the following is a key feature of metabolic syndrome that is closely related to diabetes? A. Low blood pressure. B. High blood sugar levels. C. Hyperlipidemia. D. Low cholesterol levels. Answer: B. High blood sugar levels. Rationale: a key feature of metabolic syndrome is high blood sugar levels, which increase the risk of developing type 2 diabetes. 74. Which of the following conditions is associated with an increased risk of developing type 2 diabetes? A. Hypothyroidism. B. Obesity. C. Polycystic ovary syndrome, POS. D. Both B and C. Answer: D. Both B and C. Rationale: both obesity and POS are risk factors for type 2 diabetes. Hypothyroidism is not directly associated with type 2 diabetes. 75. A patient with diabetes is experiencing severe dehydration, hyperglycemia, and confusion. Which of the following conditions should be suspected? A. Diabetic ketoacidosis, DKA. B. Hyperosmolar hyperglycemic state, HHS. C. Hypoglycemia. D. Hypotension. Answer: B. Hyperosmolar hyperglycemic state, HHS. Rationale: HHS is characterized by severe dehydration, hyperglycemia, and confusion. DKA presents with different symptoms, such as fruity smelling breath. 76. What is the primary role of the pancreas in diabetes? A. To produce insulin and regulate blood sugar levels. B. To produce glucagon and regulate potassium levels. C. To produce bile and aid in digestion. D. To produce erythropoietin and regulate blood pressure. Answer: A. To produce insulin and regulate blood sugar levels. Rationale: the pancreas produces insulin, which helps regulate blood sugar levels, making it a central organ in the management of diabetes. 77. Which of the following should be monitored regularly in diabetic patients to assess for complications? A. Blood glucose levels. B. Serum albumin levels. C. Vitamin D levels. D. Electrolyte levels. Answer: A. Blood glucose levels. Rationale: blood glucose levels should be monitored regularly to assess diabetes control and to detect potential complications early. 78. Which of the following is a common symptom of both type 1 and type 2 diabetes? A. Polyuria, increased urination. B. Weight gain. C. Increased appetite. D. Severe fatigue. Answer: A. Polyuria, increased urination. Rationale: polyuria is a common symptom of both type 1 and type 2 diabetes, caused by high blood glucose levels leading to increased urine output. 79. A patient with diabetes presents with deep, rapid breathing, confusion, and fruity smelling breath. What is the most likely diagnosis? A. diabetic ketoacidosis, DKA. B. Hyperosmolar hyperglycemic state, HHS. C. Stroke. D. Pneumonia. Answer: A. Diabetic ketoacidosis, DKA. Rationale: the symptoms of deep, rapid breathing, Kussmaul respiration, confusion, and fruity-smelling breath are indicative of DKA, a life-threatening condition in diabetic patients. 80. Which of the following is a key factor in preventing the progression of diabetic nephropathy? A. Tight control of blood pressure. B. Increased protein intake. C. Reducing physical activity. D. Regular smoking. Answer: A. Tight control of blood pressure. Rationale: tight blood pressure control is essential to prevent or slow the progression of diabetic nephropathy, which can lead to kidney failure. 81. Which of the following is the most common complication of poorly controlled diabetes? A. Diabetic retinopathy. B. Diabetic nephropathy. C. Cardiovascular disease. D. Peripheral neuropathy. Answer: C. Cardiovascular disease. Rationale: cardiovascular disease is the leading cause of morbidity and mortality in people with poorly controlled diabetes. 82. Which of the following is a complication of untreated gestational diabetes? A. Macrosomia, large baby. B. Hypoglycemia in the mother. C. Fetal undergrowth. D. Hypotension in the baby. Answer: A. Macrosomia, large baby. Rationale: gestational diabetes increases the risk of having a large baby, macrosomia, which can cause complications during delivery. 83. What is the first-line treatment for type 2 diabetes? A. Insulin. B. Oral hypoglycemic agents. C. Lifestyle changes, diet and exercise. D. Bariatric surgery. Answer: C. Lifestyle changes, diet and exercise. Rationale: lifestyle changes, including diet and exercise, are the first-line treatment for type 2 diabetes and can significantly improve blood glucose control. 84. What is the main characteristic of type 1 diabetes? A. Insulin resistance. B. Autoimmune destruction of pancreatic beta cells. C. Obesity. D. Insulin overproduction. Answer: B. Autoimmune destruction of pancreatic beta cells. Rationale: type 1 diabetes is characterized by the autoimmune destruction of the insulin-producing beta cells in the pancreas. 85. What is the recommended target for blood pressure in diabetic patients? A. Below 120/80 mmHg. B. Below 140/90 mmHg. C. Below 160/100 mmHg. D. Below 180/110 mmHg. Answer: B. Below 140/90 mmHg. Rationale: a target of below 140/90 mmHg is recommended to reduce the risk of cardiovascular and kidney complications in diabetic patients. 86. Which of the following is the most common type of neuropathy in diabetes? A. Autonomic neuropathy. B. Peripheral neuropathy. C. Focal neuropathy. D. Proximal neuropathy. Answer: B. Peripheral neuropathy. Rationale: peripheral neuropathy is the most common type of neuropathy in diabetes, affecting the feet and legs. 87. What is the primary action of sulfonylureas in the treatment of type 2 diabetes? A. Increase insulin production. B. Increase insulin sensitivity. C. Reduce glucose production in the liver. D. Slow gastric emptying. Answer: A. Increase insulin production. Rationale: sulfonylureas stimulate the pancreas to produce more insulin, helping to lower blood glucose levels in type 2 diabetes. 88. What is the primary function of insulin in the body? A. To lower blood glucose levels. B. To increase blood glucose levels. C. To digest carbohydrates. D. To regulate blood pressure. Answer: A. To lower blood glucose levels. Rationale: insulin lowers blood glucose levels by facilitating the uptake of glucose into cells for energy and storage. 89. Which of the following is a potential side effect of insulin therapy? A. Hyperglycemia. B. Diabetic ketoacidosis, DKA. C. Hypoglycemia. D. Hypertension. Answer: C. Hypoglycemia. Rationale: hypoglycemia is a potential side effect of insulin therapy, particularly if too much insulin is administered. 90. Which of the following is an effective strategy to prevent or delay the onset of type 2 diabetes? A. Reducing weight and increasing physical activity. B. Taking oral medications only. C. Insulin therapy. D. Strict carbohydrate restriction. Answer: A. Reducing weight and increasing physical activity. Rationale: lifestyle modifications, including weight loss and increased physical activity, are the most effective strategies to prevent or delay type 2 diabetes. 91. What is the most effective method for diagnosing type 2 diabetes? A. Random blood glucose test. B. Oral glucose tolerance test, OGTT. C. Fasting blood glucose test. D. HbA1c test. Answer: D. HbA1c test. Rationale: the HbA1c test provides an accurate diagnosis of type 2 diabetes by measuring average blood glucose levels over the past 2 to 3 months. 92. Which of the following is an important dietary modification for managing diabetes? A. Increase intake of refined sugars. B. Increase intake of whole grains and fiber. C. Increase intake of saturated fats. D. Increase intake of high-calcium foods. Answer: B. Increase intake of whole grains and fiber. Rationale: increasing the intake of whole grains and fiber helps regulate blood glucose levels and improves overall blood sugar control. 93. Which of the following is an early sign of diabetic neuropathy? A. Blurred vision. B. Pain and tingling in the feet. C. Chest pain. D. Weight loss. Answer: B. Pain and tingling in the feet. Rationale: early diabetic neuropathy often presents with symptoms such as pain, tingling, and numbness in the feet. 94. What is the most common cause of death in people with type 1 diabetes? A. Stroke. B. Cardiovascular disease. C. Kidney failure. D. Diabetic ketoacidosis, DKA. Answer: B. Cardiovascular disease. Rationale: cardiovascular disease is the leading cause of death in people with type 1 diabetes, often due to long-term complications of poorly controlled blood glucose. 95. Which of the following medications is an injectable GLP-1 receptor agonist? A. Glympuride. B. Insulin glargine. C. Exenatide. D. Metformin. Answer: C. Exenatide. Rationale: exenatide is a GLP-1 receptor agonist that is injected and helps lower blood glucose levels by enhancing insulin secretion and reducing glucagon release. 96. Which of the following best describes the relationship between insulin and glucagon? A. Insulin increases blood glucose levels, while glucagon decreases blood glucose levels. B. Insulin and glucagon both increase blood glucose levels. C. Insulin decreases blood glucose levels, while glucagon increases blood glucose levels. D. Insulin and glucagon both decrease blood glucose levels. Answer: C. Insulin decreases blood glucose levels, while glucagon increases blood glucose levels. Rationale: insulin decreases blood glucose levels by promoting glucose uptake, while glucagon raises blood glucose levels by stimulating the liver to release stored glucose. 97. What is the primary goal of using insulin pumps in diabetes management? A. To provide constant insulin release. B. To reduce blood pressure. C. To prevent diabetic ketoacidosis, DKA. D. To manage blood glucose with fewer injections. Answer: D. To manage blood glucose with fewer injections. Rationale: insulin pumps allow for continuous insulin delivery, which helps manage blood glucose more effectively and reduces the need for multiple daily injections. 98. Which of the following is the most common cause of kidney failure in people with diabetes? A. Hypertension. B. Diabetic nephropathy. C. Dehydration. D. Glomerulonephritis. Answer: B. Diabetic nephropathy. Rationale. Diabetic nephropathy is the most common cause of kidney failure in people with diabetes, leading to a progressive loss of kidney function. 99. What is the most important factor in the prevention of diabetic foot ulcers? A. Regular exercise. B. Proper foot care and early detection of foot problems. C. Smoking cessation. D. High-protein diet. Answer. B. Proper foot care and early detection of foot problems. Rationale. Proper foot care, including daily inspection for wounds or sores, is crucial in preventing diabetic foot ulcers. 100. Which of the following is a common risk factor for type 2 diabetes? A. Increased age. B. High-fiber diet. C. Insulin resistance. D. All of the above. Answer. D. All of the above. Rationale. Increased age, a high-fiber diet, and insulin resistance are all common risk factors for type 2 diabetes.